Sanbonani, and welcome to the first episode of Tyhilana Let's Talk. My name is Tyhilana, and this episode will be called Coming Out Let's Talk the Basics. So this is the first episode out of my limited series on navigating sexual health as a queer person in South Africa. So I call this Coming Out Let's Talk the Basics, so we can essentially talk about access to healthcare, where to go as a queer person in South Africa, as well as just condoms and how to use, not how to use them, but I feel like there's a narrative that is missing in our condom use, like in our condom talks and our safe sex talk. I'll start by saying that I have medical aid. However, I found that I prefer using your clinics that cater for men who have sex with men, or people who identify as gay, bi, or people in the LGBTQIA plus community, because those clinics create a safe space and a non-judgmental space for us to just, be, versus having to come out and the whole process of like it's so much admin having a private doctor in terms of just as a queer person, because coming out essentially is very mentally exhausting, and so it's very difficult for me to keep coming out to every single doctor that I go to. Every single time I go to a doctor, oh yeah, so who's your girlfriend? I don't have a girlfriend. So it's like but when you go to clinics like Health for Men, Engagements Health, and Triangle Projects, the first question mainly is, what do you identify as? And for me, that question just changes the whole conversation and makes me feel like I belong, you know what I mean? And I also feel like it has an impact on the quality of care that I receive wherever I go. So the first clinic that I want to talk about is Health for Men, which you can find in Johannesburg and Cape Town. Health for Men for me is my favorite one. If for all the people who are in Cape Town, Health for Men is behind the waterfront. So it's in the hospital, Somerset Public Hospital. It's inside there. You just ask for Health for Men, they'll guide you to it. So Health for Men for me has given me like, I felt like with Health for Men, I feel like Health for Men is even better than my doctor. I'm sorry to say this, but I feel like Health for Men is better than my doctor, because, for example, I did not know that you can get a rapid syphilis test, which is essentially a prick, the same way you test for HIV and AIDS. And yeah, so the same way that you test for HIV and AIDS, you can test literally for syphilis in 5 minutes. Outside of that, Health for Men creates a very inclusive space for men who have sex with men, and also the professionalism that is there for me has been interesting, except for when there was a time where I'd bump into the nurses at Groove. That was the only part where I was like, girl, I don't think I want to go back to the clinic. But that's just me being privileged, and also just being ashamed. Do you know what I mean? But then that's why I also created this channel, to create a space and a platform that is non-judgmental, Anyway, the second clinic that I want to talk about is Engagements Health. Engagements Health focuses on community outreaches, which is what I appreciate about them, because they go to the people versus waiting for the people to come to them. So they choose, I volunteered with them last year in June, and they go to different communities to go and educate people on ARVs, PrEP, and STIs and STI screenings. And it's available in Port Elizabeth, East London, and I think Johannesburg, yeah. And then you have Triangle Project, which focuses on a holistic approach to healthcare services. So they cater for everyone in the LGBTQI plus spectrum, every single person. And also they have mental health services. So I generally go to therapy via my medical aid, and medical aid, if you use GEMS, GEMS. So medical aid usually runs out, or you used too much and then you can't use it anymore. So what Triangle Project does, essentially, I could go from, my therapist was part of the Triangle Project database, so I could go through Triangle Project for free whenever I wanted to. That was a thumbs up. And I know a lot of people are suffering with mental illness, and it's very difficult to go, and therapy is expensive. Like, you're looking at minimum 500 to 1,000 per consultation, so it's unfeasible. So spaces like Triangle Projects, they cater even for women. Like, they are they probably one of my favorite clinics outside, but all of them are my favorite because, you know, they're pro-queer. But yeah, all of these organizations do a lot of good work in their own respective rights, but Triangle Project for me stands out because of the whole mental health section that they offer. But yeah, so, you know, another reason why I wanted to start this channel was because I feel like when we tell people use condoms, use safe sex, we don't have that nuance that, like academics, they have that thing, nuance. I feel like we don't talk enough about latex sensitivity and how condoms, for some people, not everyone, can literally make your sexual experience very, very tricky. I mean, so when you have a latex allergy, you have burning sensation while during coitus, or you have itching, or you may develop a rash. Those are the 3 symptoms that, according to Google, you can find, and also my doctor when we spoke about it for my case. So with me, I went to my doctor 3 years ago, and I told her, I was like, girl, I'm struggling with this sex thing because it's unbearable. There's pain because of, and I didn't know what it was. I just was like, it's painful when I have it with the condom, and then when I don't have it with the condom, it's not painful. And then she was like, that's very scary, that's very risky. You know what I mean? Risky, like, we need to sort that out. And then we started talking about and looking into latex sensitivity, and then I had to now look for non-latex alternatives. So non-latex alternatives are condoms that are made out of polyurethane or polyester. Girl, these names, I don't know either. But I found a condom via just someone I was seeing at the time, who happened to be using a condom that was non-latex. I don't know the reasons for why they were using a non-latex condom, but it's also, that condom is just a nice condom. Like, if you're going to be using, if you want good condoms for good sex, like use Skyn. I don't have any right now. I just have these ones that I got from a friend because, yeah, I don't know, I don't use these though, you can see this, but I don't use these because, yeah, painful. But these are the studded ones. The smooth ones I can use, but the studded ones, no. If you use studded condoms, please tell me why and what they're made for and who's supposed to get the pleasure. Is it the top or the bottom or the, like, please explain. I don't know what studded condoms are for. Like, who gets pleasure from using these things? But yeah, so I feel like when it comes to condoms, you need to check whether you are, like, you know, like, I've had this conversation with a variety of people, men and women, and it's always been a thing of, there's a conversation of, hey babes, some people are like, I don't like using condoms because it makes the sexual experience for me very unbearable. And then they would describe, like, for me, I call it latex sensitivity, but it's a latex allergy. So they would describe those kind of symptoms. And for me, I'm like, I don't want to be the one to prescribe anything, but I always just prescribe Skyn, which is non-latex, because I'm still for safe sex. However, on the topic of doctors, so if you're someone who generally doesn't like just clinics generally, because I also don't like clinics, there's the new concept called yellow doctors. Yellow doctors are supposed to be doctors who equip themselves with just creating a space for LGBTQI plus people so that they can provide healthcare that is non-judgmental. So essentially, yellow doctors are what I wish my doctors were. Like, I wish my doctors were yellow doctors. I don't know why they're still not yellow doctors, because they have me on their database. So surely now they have to be equipping themselves with providing better care. But if she sees this, you know most. But yeah, these are the clinics that I would suggest you go to. Outside of that, if you are more leaning towards barebacking, if that's what you call it, or going raw because condoms cause a lot of discomfort for you, I think you should check out non-latex alternatives versus just going raw, because we'll talk about that in the next few episodes. But yeah, thank you for tuning in. Don't forget to like, comment, and subscribe. Mwah.